Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here is what we have for you all from the world of medicine. How a prolonged hospital stay period might affect or rather increase the risk of pulmonary thromboembolism. Patients with pulmonary thromboembolism are commonly admitted to the hospital and generally or usually have a very prolonged hospital stay. Now, the researchers have aimed to determine whether the different clinical and laboratory parameters that are associated with a prolonged hospital stay and also have understood or rather analyzing the effectiveness of pulmonary embolism severity index score as a predictor of prolonged hospital stay in patients with pulmonary thromboembolism. The study that I'm talking about is published in the Journal of the Associations of Physicians of India, and observational prospective study. It confirmed the cases of pulmonary thromboembolism, all those who were defined as patients with evidence of a thrombus when examining on their CT pulmonary angiogram. Depending on the length of the hospital stay, the patients were divided into two cohorts. One was shorter hospital stay that was less than 10 days period, and the other one was a prolonged hospital stay which included a stay which was beyond the period of 10 days. In this, a total of 150 patients were included, with 44.67% patients having a shorter hospital stay and 55.3% having prolonged hospital stay. It was hence concluded that pulmonary embolism severity index class can be effectively used to predict the prolonged hospital stay in patients with pulmonary embolism. Also, patients with hypotension at presentation, decreased level of consciousness and ECG abnormality are more likely to prolong their hospital stay. How critically low magnesium levels can impact ICU patients. Many previous studies have found that only hypomagnesemia but not hypermagnesemia is linked with an increased mortality. However, reports of mortality due to a magnesium dysregulation in the critical care setting is still controversial. To study this, a report in the Journal of the Associations of Physicians of India studied the association between the serum magnesium levels in critically ill patients on their admission to the intensive care unit and also studied its correlation with patients' need as well as the duration for ventilator support, the duration of the ICU stay, incidence of cardiac arrhythmias and mortality. A total of 246 critically ill patients who were admitted in the ICU setting were included. The serum total magnesium levels were measured at the time of their admission. Primary outcome measures was characterized as an ICU mortality, whereas secondary outcomes were the patient's need as well as the duration for ventilator support, the duration of the ICU stay, and also the incidence of cardiac arrhythmias. Incidence of ICU mortality was found to be significantly higher in the group of patients with hypomagnesemia compared to those with the normal magnesium levels. Hypomagnesemia was associated with the need as well as longer the duration of ventilator support, also the longer duration of an ICU stay, higher incidence of cardiac arrhythmias compared to patients who had normal magnesium levels. Hypomagnesemia was an independent and statistically significant determinant of ICU mortality. Therefore, it was concluded that hypomagnesemia was associated with a higher mortality rate, longer duration of ventilator support, as well as prolonged ICU stay in critically ill patients. A recent set of guidelines that were released for the management of liver cancer. Hepatocellular carcinoma is often asymptomatic in the early stages and the advent of symptoms may be ominous. The triad of the right upper quadrant pain, palpable mass and weight loss may be seen in symptomatic patients, while abdominal distension as well as abdominal pain and cramping were the most common symptoms according to different series, and a new onset of such symptoms in a chronic liver disease should raise suspicion definitely. The guidelines have stated that early detection of such hepatocellular carcinoma cases is associated with better outcomes. Attempts should definitely be made to diagnose the hepatocellular carcinoma in the asymptomatic phase during the surveillance period. They also stated that hepatocellular carcinoma should be suspected in patients with acute decompensation of cirrhosis, sudden deterioration of liver biochemistry, new onset of right hypochondriac discomfort in a cirrhotic new onset ascites, or even worsening of the ascites conditions, acute variceal bleed, as well as the appearance or an increasing size of any new lesion on imaging in a cirrhosis cases. Hepatocellular carcinoma is associated with very poor prognosis except for the subgroup of the patients who are diagnosed at a very early stage and hence are amenable to curative therapy in the form of either resection, ablation, or even transplantation can be taken into consideration. However, majority of the patients are diagnosed at a later stage in India, precluding the use of curative therapy. Hence, there is definitely a need for active surveillance of patients at risk to diagnose hepatocellular carcinoma at an early stage, which will translate to reduction in disease-related mortality. The surveillance of hepatocellular carcinoma cases helps in the detection of the tumor at a very early stage and also helps in timely intervention to reduce the mortality, and there is definitely a new hope in managing cancer. The controlling hypertension causes among Keralites. A prescription-based study was conducted to identify the provider as well as the institutional level factors related to achieving guideline-recommended control of hypertension as well as diabetes mellitus in the state of Kerala. The cross-sectional study, both in the primary as well as the secondary care hospitals in Kerala, it included public as well as private institutions. One practitioner was selected from each of the institution. Prescriptions were photographically captured and the data on disease status as well as the drugs that were prescribed were all put into records. Totally, around 4,600 prescriptions were included for the analysis. For hypertension, only patients, the control levels were 31.5% and was found to be significantly higher in public hospitals. While among patients with diabetes only, diabetes control was seen in 36.6% of those cases. Now, when both conditions were present, the control was achieved in only 17% of the population. Being prescribed 2 or more drugs indicated a lower control. Hence, in this prescription-based study in Kerala, a majority of hypertensive patients did not have controlled blood pressure levels, particularly if diabetes coexisted. This has a serious implication as Kerala is the state with the highest burden of hypertension in India. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.